We are going to be doing a wet to moist dressing. This is used with patients who are unable to afford enzymatic debridement. They're used while awaiting orders from a wound nurse or a physician for a more appropriate debridement method. This is capable of maintaining granulation tissue more often than the choice of dressing as collagenase.
30 minutes prior to the dressing change, I would come in here and assess the pain of the patient, asking them to rate it on a scale of 0 to 10, 0 being no pain, 10 being the worst pain, and medicating as needed for pain.
Hi, my name is Kristen. I'm a student nurse. I'm going to be changing your wound dressing today. Can you state your name and date of birth? And then I would check that to the EMR and their wristband. And are you having any pain today on a scale of 0 to 10, 0 being no pain, 10 being the worst pain? Alright, so then I would raise the bed to about hip height, hip level, and then close the curtain and perform hand hygiene. And then put on my non-sterile gloves. And I pull back, making sure that the patient is comfortable. And I pull off the dressing using the push-pull method, starting at the edges. Then I remove the dressing. First observing for drainage, and looking at this, it looks like sanguineous drainage with purulent drainage as well. And then observe the wound itself. So the same sanguineous drainage with the purulent drainage accompanying it. And there's a slight odor, signs of infection. And observing the wound itself, it's beefy red, so good perfusion. It does seem to have some redness around the perimeter, a sign of infection. And the skin feels to be warm, another sign of infection. So it's red, warm, had that purulent and sanguineous drainage. So we're going to be changing that wound dressing. So first things first, we need to measure the size of the wound, and it is about 14 centimeters. Next, we measure the depth and for tunneling. Kind of lightly measuring how deep it is. And it's about 3 centimeters deep. And this would also be where we obtain a wound culture. If the wound culture came back positive for MRSA, we would initiate contact precautions. We would wear a gown when changing the wound and providing any cares for the patient. And so next I took off the old gloves, cleaned my hands, hand hygiene, and then applied some new gloves. And next I'm going to set up my supplies for the sterile wound dressing change.
So next I'm going to remove these gloves. I finished setting up my clean supplies, hand hygiene. I'm going to apply my sterile gloves. Wait, do you want to pause it? So next I'm gonna clean the wound now. So pinch to pick up one of the gauze. Removing some of the excess water and cleaning from the middle out and tossing, picking up the next, cleaning from the middle, cleanest to dirtiest, picking up another gauze, and just repeating that step, middle to out. Middle to out. So next I pick up this gauze, both pieces, wring out some of the water just so the bandage is just moist. And lightly packing the wound. I don't want to stuff it in there to prevent blood flow. Just lightly putting that in there. And next I'm going to grab my abdominal dressing. And then apply that there. And now that the wound is covered, I'm gonna apply the window technique with the paper tape. Ensuring that it securely adheres to the skin. And lastly, I label the bandage with my initials, the date, the time. KH. And it is Lastly, documentation is very important. So we document the measurements, the odor, the drainage, the date, the time that we completed it, if there was tunneling, the location of the wound, the infection signs and symptoms if they were present, the type of the dressing, and the patient's level of pain.